Yeah,
Well,
I
that's
just
fine. I do Zooms all the time, and I know what you're talking about. So,
it's like as soon as you go live, all the problems happen. Okay, welcome to Wellness Wednesday. We are live. I am Stephanie McNaughton. If this is your first time watching, please let us know in the comments where you're watching from. And I am so honored and blessed to be with Tom Hickey today. Tom Hickey is an incredible resource for all of us because he's a chiropractor for 39 years. He's a naturopath doctor and he's certified with, is it RGCC? So I would love to have you share a little bit about what all that means.
well, thank you, Stephanie. I appreciate that. I really appreciate the opportunity to just share whatever I can and that type of thing. And when I was talking to you before, we were talking about the healthcare arena, and we were talking about functional health and holistic health type practices and that type of thing. And what I have is a fully functioning um, online functional health practice, and so I order tests, and I work with people to be able to determine what avenue would be the best direction to take based on a lot of different tests that I do. So when it comes to chronic disease, I like to utilize 5 or 6 different tests that are pretty common to most people. I like to do blood tests. I like to do urine tests. I do stool samples and saliva tests, and a number of other types of tests. But that's what helps me get some idea as to what direction we really want to take, because we want to find the root cause of these disorders and that. And what has really topped my list lately, and I talked to you about this before, is the idea that I have most of my clients right now are actually cancer clients. And I like to work with cancer clients in a capacity that I call a client or a cancer client advocate. And that way I can do some testing, and we do that through RGCC, which is Research Genetic Cancer Center. And we send in a blood sample from our client who has cancer. We send it to Greece. And once we get that blood sample back from Greece, we can analyze what their cancer is telling us. And basically, there's 3 major areas that the test talks about, and the number one thing is the circulating tumor cell count. So once we get an idea of what the circulating tumor cell count is, then we have a baseline, and then what we can do then is we can evaluate from the test, if this particular client would like to have their oncologist see the test and that type of thing, because I always like to work with people who have oncologists that they're working with. And then what it does is we test about 60 different chemo drugs. Wow. And what their blood test is telling us is that you would really benefit from utilizing cisplatin, let's say, or 5FU. There's so many of them, but what we do is we get a balance out. And so what we're doing is we're testing the blood with with 6 doses of the chemo drug to see if it does anything to their cancer. And if it's 82%, falls within 82 to 83%, we know that it'd be effective. So often, though, we see it 20%, 25%, and that's just going to be toxic to the body. We know that, and the cancer is not going to really respond that much to it. So it gives us a baseline. It gives us an idea of what we can do from that standpoint. The other thing that I really like is that we also monitor the natural substances. So we test about 60 natural substances, and we can see how does their cancer respond to these natural substances. And there are things like CoQ10, melatonin, vitamin C, 3 different types of mushrooms, that type of stuff. And what we find is that oftentimes one dose of a natural substance can be really, really effective against their cancer. And so the test tells us these things. And so then what we can do is we can put up a protocol for that. So and then basically we get an idea on that. And then the third thing that we test, so it's the circulating tumor cells, then it's the effectiveness or how effective natural substances and chemo drugs are from a sensitivity standpoint to their cancer. And the third thing is we test their genetic expressions of about 80 different genes. And once we can see if some of these genes are overexpressing, they're allowing the cancer to continue to just keep thriving.
Wow.
That's what cancer wants to do in the first place, is it wants to live forever. And so when you see these overexpressed genes, we need to be able to understand which ones are overexpressed. And then we know that there are certain things that we can do for that. And we work that into the protocol.
Wow. That's incredible. Yeah, there's a lot of people that I know that are dealing with cancer with either themselves or loved ones or lost people. And I think this is such an incredible resource because if you get this diagnosis, it's terrifying. And there are very limited resources for holistic tied in with regular mainstream medicine. So, and something else that I wanted to ask you about that, even so, chemotherapy has side effects. I mean, all medicine has side effects. Can nutrition benefit even with those side effects? Are there things that you can do to support the side effects?
Yeah, there's several things that that we actually do to help in the area. If somebody's taking a chemo regimen, and usually where they really have the problems is when they get an IV infusions. If they're doing an oral chemo, not as harsh. They've been able to do that a little bit differently. But there are things that people can take and do from a natural standpoint that does help their chemo experience and that type of thing. And there's a whole list of stuff that you can go through and stuff. And you as a health coach, we're always looking at research articles. We're looking at podcasts. We're doing all of these types of things to continue to help our clients along. And so there's resources for all of that. Yeah.
That's amazing. I love that. So I think you mentioned in our call the other day also that you work with some autoimmune disorders and things like that. So can you just kind of give us a broad spectrum of like what kind of clients would come to you? What kind of people would come to you?
Yeah, absolutely. So I'm going to back up just a little bit and give you just a little teeny bit of history. And that is that when I first started practicing chiropractic over 45 years ago, I would see over the course of really a year, maybe 3 or 4, maybe 5 autoimmune disorder patients. They would have type 1 diabetes, maybe rheumatoid arthritis, let's see, multiple sclerosis, lupus. Okay, so 4, 5, 6 different types of autoimmune disorders. When I sold my practice to my son 4 years ago, I would say on that particular year, I probably saw, oh my gosh, in that one year, I probably saw 300 patients with autoimmune disorders. And some of them I'd never heard of. Some of them had been, newly diagnosed and different things. So what I'm saying is that on a bell curve type of situation, there's no downward slot. It's always up. And so I see everything from Hashimoto's, with the thyroiditis and that type of thing, with thyroid problems, to rheumatoid arthritis. I work with type 1 and type 2 diabetes, and that type of thing. Again, we put them through tests that allow us to just make so many different decisions based on what we see off of these tests. And that's where we're kind of working our way back to finding that root cause.
Wow.
And so, so it's been great.
That's incredible, because I find that most of the time when I've helped people that are going to the doctor, it's treating symptoms and not really getting at the root cause. Now, I know chemotherapy is different, right? That's trying to kill off all the cancer cells, but so many of these medications too have side effects for all kinds of different things. And so we just have to be careful, because and doctors are often, it's like you go to the doctor for your heart over here, and then you go to this doctor over here, and they're not communicating. So it's really good to have somebody that's advocating, that's testing your blood, that's checking to make sure that everything's working together and nothing's like hurting, like adding complications from overdosing. I have a friend who said that this was just recently, she just was, she was sick, and they said that they gave her too many medications, and she's got all kinds of gut issues and all kinds of issues now that she didn't have before. And so she's having to do like a detox kind of a thing. Is that something that you help with, is detoxing? And
Yeah, for sure. And there's systems that we like to detox. Of course, you want to detox the liver, you want to detox the lymph system, you want to detox the bowels and the GI tract, and that type of thing. You want to detox the blood. There's ways that we can detox the blood, and that. So yeah, there's a number of different avenues that you take to help in the area of detox. One of the things that you had mentioned before, talking about medications and different things like that, is as a client advocate, whether it's with autoimmune disorders or cancer or whatever, I'm always given the opportunity to get a user login and password to get into their MyChart accounts. And so once I get into their portal, I can go through and I can look at all of the things that their general practitioners providing for them, or their oncologist is providing for them, or whatever, so that I can at least look through, evaluate, look at what's going on. And I have several clients that want me to look at their blood work right after they've had their blood work, because oftentimes, they'll go in and the oncologist will say, yeah, gosh, everything looks great. You're doing super good. We'll keep her going in that. But then you'll look at it and you'll see some things are not super great, and they need to be aware of some of the things that are not super great. Mm-hmm. And if that's the case, then we can kind of dive a little bit deeper and explain to them some things that, for instance, I'll just use this as an example. Say a cancer client has their white blood cells are supposed to be, between 4.5 to say 7, somewhere in there, midline 6 would be great. But theirs is now like 1.8. Well, that's not great.
Right.
That's your immune system. That's what's fighting off things. So whether it's 1.8 with a autoimmune disorder or somebody else that's got a chronic disease, a heart disease, that type of stuff, 1.8 is needs to be we need to look at it and find out what's going on with all of that. So
Yeah.
yeah. So
then you would probably look at deficiencies and things that can help boost the immune system to help support that and building that back up.
yes, absolutely. And it's interesting because oftentimes we look at root cause. What's a root cause? Well, I've been doing a lot of research lately, and I'll just throw this out. This is an interesting fact for me. Somebody was talking about utilizing certain off-label drugs for certain cancer care scenarios, and different people will hear about using ivermectin or fenbenzidol, and these are like dewormers. They work viruses, things like that. And I thought about it one day when I was listening to a podcast, and I thought, that's very interesting. How is it that works for cancer viruses? And that, like ivermectin. So I'm thinking, well, what's the connection there? So I started doing some research, and I looked on PubMed. You ever get on PubMed, the national database for all research that gets put out there in the United States? And I typed in viruses, cancer, and I got 244,000 articles that's been written on viruses and cancer. So I went through, I don't know, 5 or 6 pages of these just to see what they were all about. And the linking between viruses and cancer is crazy. I didn't know that a year ago.
Wow.
I didn't know that a year ago. I didn't know that 2 years ago. I thought this is really something. So there is a connection. And if our immune system is being brought down, what is one of the root causes? It could be parasites. It could be something like a virus, And so within the RGCC group of practitioners worldwide, literally, some of them are really heavy into, and I don't do this personally, but I refer people to ones that will look at Lyme disease, other like Epstein-Barr virus, some of these other types of things that in their research has showed them that these are root causes. These are root causes for certain cancers. And so when I do a blood test for somebody that has cancer, and some of the different natural substances that come up, artisan, or artesunate, and super artemisinin, if those three are a triad and they all spike because their cancer doesn't really like it, that can give you an indication that there might be some parasite that's working in their system, because the natural substance that we just tested on those three is sweet wormwood, and that's been utilized over years to help with parasites.
Yeah. Wow. I've heard this, and there's so much all over social media about parasites and ivermectin and all that stuff. And I honestly, it's over my head. I have no idea, and I won't speak to it if I haven't done my own research or heard it straight out of like your mouth or Dr. Jim McAfee or someone.
Yeah.
But so there is some truth to this ivermectin, and there is some truth to the whole parasite thing. How would you know if you have parasites? Now, this is a great question because personally, I'd love to know. I hear friends tell me, I have endometriosis. So she goes, that could be linked to parasites. So tell me more about that.
That's a great question. Parasites, you can, and I do quite a few stool samples. And so that's one avenue. There's other avenues that a person can take to really specifically get into the parasite realm. And there's certain Great Lakes labs and Great Plains labs, I'm sorry,
Great Plains.
test. And they have a great series of tests that you can do if you're really looking for parasites.
Yeah. Okay. So then let's say I have parasites that's causing my endometriosis. Would I then have you work with me to figure out how to detox, how to get rid of them? Or should I go on the internet and like look up what other
We all do that, don't we, though?
Kind of.
That's
yeah.
Dr. Google. Yes, that's what I like to do is on my website, hickeyhealth.com, I have a little bar that you can press, and that'll allow you a free 30-minute consultation. And I like to do that because a lot of times if people text you back and forth or email you or whatever, you can't get in and you can't discuss the certain scenario of what's causing their or what their problem is, what their symptoms are, how they've been treated in the past, all these type of things. And we can cover a lot of ground in 30 minutes, and it's free. It gives me an opportunity to meet them and see kind of what their needs are.
I want to do that. I want a 30-minute free 30-minute consultation. I would love to do this blood work myself, because you don't know what's going on sometimes. Even if you don't have symptoms, sometimes there's stuff going on that you don't know about, maybe even deficiencies or whatever. And it's a good idea to periodically just know what's going on inside your body. I've been told, I did some blood work with another naturopath doctor, and I was told I have no symptoms whatsoever. She goes, you need some enzymes, digestive enzymes, because, and this is like the only thing that because I didn't have symptoms, I didn't take enzymes. and I go, you don't say. The only thing I don't take, and I'm a mom of lots of kids, so I'm like, shove food down there. I don't chew it all the way, right? Like, swallow it half whole. And so I wasn't anyway. So now I started taking digestive enzymes, but I would have never known had she not done the blood work.
Yeah, exactly. And boy, that's the truth. So a lot of times we look at root causes and stuff. Well, we want to look at the area where the root cause can really manifest itself, and gut health is number one.
Right.
Yeah. And so that as well as so many of the listeners and stuff that gut health is really, really important.
Yeah, and I did it live on Gut Health a few weeks ago with Susan Adams. She's a registered nurse.
Yep.
And
I know Susan. I love Susan.
She was watching on here, so hopefully, maybe she's still watching. If you are, hi Susan. And those are on my page, Stephanie McNaughton's page. So if you want to go back and look at any previous lives, I have one on gut health, and I did an interview with Elizabeth Martin. She's watching too. So this is so much fun for me. I just want to say I am part of a nutrition company, and so is Tom. We are not affiliated with each other. We're not on the same team, but this company has just an outstanding community of people that all just love to help people. And we're not out for self-gain. I'm actually not even on here to promote anything specific other than give education and resources to people. And what I really love is to share things that are vetted, that I know I can trust, because there is so much misinformation out there, and it's just crazy. Even me, I'm like, is this real castor oil? Is putting castor oil on my, breast cancer, is that safe? Is it effective? Honestly, I don't know the answer to those questions. I wouldn't try it though, unless I was told by someone like yourself that was an okay method of treatment. Anyway, do you have anything to say about castor oil?
Well, I've got one client that's using it, and it has been helping her
That's
in
awesome.
that. And she found it before we actually started working together, and then we brought in another practitioner that um, uses it in her practice as well for breast cancer and that. But
See, I've heard
castor
that,
oil,
but I don't
yeah,
know. So that's interesting to hear it coming from you and
yeah,
seeing that it's actually helping. That's
yeah,
wonderful.
yeah,
But
yeah. It
I know there's
definitely
so
makes it.
many.
Yeah. Yeah, and you mentioned about the vetting of a component of certain nutrients or certain lifestyles or whatever it would be, and and you mentioned the company that we are affiliated with. Um, what I think is interesting, I've been with the company for 15 years, 14 years, and the thing that I think is so interesting is we're provided so much information that over a period of time, we all go into these different directions of health, of health. I mean, you've taken on kind of this role of a health coach, and a lot of it's because you've really had so much knowledge and information that gives you empowerment to be able to help others,
Mhm.
and and that's what I believe our company has done is it's educated us in an area that we feel very very comfortable to make recommendations in certain areas of people's health, just because we have been trained, we have been given the information, and we can then be a conduit to get the information back out to other people. So yeah, I love that
Yeah.
aspect.
Oh, I do too. We have the most incredible scientific advisory board, and they're out there educating us. And they just had a talk on menopause,
Yeah.
which was also incredible. Do you help women through that as well?
Oh yes. Yeah. Yeah.
That's a hot topic
Absolutely.
right now.
Yeah.
So basically, like if I have anything, I could just come to you, do a 30-minute consultation, and if you and I decide to do blood work or stool samples or whatever is needed for
Uh-huh.
whatever I
Yeah.
want to deal with, I can hire you to do that, and then you'll make recommendations and you'll work alongside with me to get me back on track and totally healthy at the cellular level, right?
Absolutely, at the cellular level. And what I really like about the approach that I've been able to do now for the last couple of years is I can send all of the test kits to the person. They can do it right there in their home. If they have to have blood work done, we utilize LabCorp, and they have centers all over the country.
Yeah.
And then I get back the report, and they're all very similar. So it makes it easy to go over the report with that. But any of the kits that we send out, whether they're a urine sample kit or a stool sample kit or a saliva sample kit, it's all done right there in their home. It's very easy and explanation. I can walk them through it. And then we do Zoom calls, and we do those to be able to go over the report, to go over the protocol, and then any kind of lifestyle things and stuff we work with, and yeah, it's very good. I love it.
That's awesome. I
Yeah.
think what you're doing is incredible. And I'm so thankful that you are willing to come on here and share your expertise and just what you're doing, because I think that so many of our viewers could benefit from your services. If you want more information about Tom Hickey or whatever, and you're watching this, go ahead and comment in the comments, more information. We can get you connected. And he also mentioned his website earlier, and you can go directly to his website. And yeah, I really appreciate everything, all your wisdom. You're amazing.
Well, you're too sweet. I appreciate that. It's just years and years of just being in the area of natural health has just really given me and my family a huge boost in just you know nobody's on medication here at the house. We're we're all doing fantastic that way. And when you think that the average person, by the time that they're in their 50s, about 10 medications, they're on about 10
I know.
medications.
Yeah.
And it's like, oh, I think we can do something better than that. So
That's great. I love that. I work with Marilyn Plum. She's my aunt, and she's I think 78 years old. Doesn't look it. She's not hasn't been on any medications ever. And she's hasn't been sick in over 30 years. Like, it's just incredible. And that's just one story. I hear stories all the time with this people with this company. Like, it's a lifestyle thing. It really
yes, it
is.
is. Yes, it is. Yeah, because I do have a number of cancer clients that'll come to me that'll say, am I going to have to change what I'm doing? I go, yes, you're going to have to change what you're
Yeah.
doing. Yes.
Yeah. My mom had that, and she had to change everything in her life. I mean, even her water, no more plastic, no more plastic water bottles, people. Stop it. And what else? Changing her toothpaste, changing her diet completely, cut out sugar. Sugar is like poison for everything,
It
right?
is. Yeah.
And just so many things. And there's just, it's really interesting when you start learning and discovering. I mean, I'm down the street at my friend's house the other day, and the kids are drinking 7-Up Slurpees, and they're just like humongous with all these food colorings. And I'm just going, oh, this is painful to watch, because I know how toxic this is. And they're eating like cup of noodles. And I'm just going, people actually eat like this? Because I'm so used to, like, it's just second nature to me now with all the, I've been doing this for 20 plus years, where I'm like, no, I would never put that in my body. I read the ingredients on everything I buy. And if there's like more than 3 or 4 ingredients, I tend not to buy it.
Yeah. Yeah. And we through our process, we help people become label readers.
Yes. I try to do that
Yeah.
with people I work with as well. Yeah, read labels, which I want to have a live on how to do that, and pay attention to the word. Can you read the word? Do you know what it is? Is it a chemical or is it a food?
Yeah. Very few foods are hard to figure out how to, pronounce them and stuff.
Right.
Yeah.
Yeah, like whole wheat. You can read that, but then there's all these other things, and I don't even know. I'm trying to teach my kids that. I've actually done a couple of I homeschool my kids, so I've done a couple of nutrition classes for kids. Not about supplements, not about anything other than, like, what are you eating? Your body needs protein. You need fruits and vegetables. You need clean, you need to avoid sugar, right? All the things. So okay. Well, I have taken a lot of your time. It's been almost an hour, I know, with all our tech issues. I have loved learning from you, and I definitely want to stay connected with you. And I'm going to go on your website. I'm going to schedule a 30-minute for me. And I highly recommend anybody that's watching this, if you feel like there's stuff in your body maybe you don't even know about and you want to know about it, you've got to get in here with Tom. If you want more information about anything we talked about, feel free to comment or send a private message. If you want to have a 3-way call or anything like that, where we can really dive deep and get you on a program, we can do that too. So thank you so much for joining us, Tom. Thank you for watching. All of you that are watching, if you're watching the replay, please let us know in the comments. I'd love to see who's watching and where you're watching from. And I just want to say thank you, Tom.
You're so welcome, Stephanie, and thank you for having me on, because as you can see, I'm kind of passionate about what I'm doing. So thank you. I appreciate the forum that you have, and the different ones that you've interviewed in the past. I think it's fantastic. I love Jim McAfee, and he's just a wonderful, wonderful person, and Susan Adams, and I just we feel very blessed.
Yes, absolutely. I am too. Well, thank you so much. I'm going to go ahead and end this here. You have a fabulous day, all of you watching, and you as well, Tom, and enjoy the rest of your day.
Thank you.
Bye.